I appreciate Byron giving me a few minutes up front as we make the transition from this morning, where there was a lot more conversation and overview on kind of the big picture of health insurance and what some of the terms are, to this afternoon where we're starting to get into a little bit more of best practices, ways that you hopefully can take some of this information back and use it in the work that you do, whether you're educating folks on health insurance, whether you're enrolling them in SNAP and any other social service, that hopefully all of this information this afternoon can be useful in supplementing a lot of the good work that I know folks in this room are doing. One of the reasons that I had asked to just have a few minutes on young adults is because I think that there are a few misconceptions out there about young adults when it comes to health insurance that we've found over the last couple of enrollment period. And we're hoping that you in this room will help to work to more actively engage some of those folks if you aren't already, and then to highlight a couple of the best practices that we've found in reaching that demographic. And let me start by saying that one of the reasons we focus on the young adult population, and by that we talk about 18 to 34-year-olds, is that they're the largest generation right now in the United States. And here in Arizona, 23% of Arizonans fall into that 18 to 34-year-old category. And so we know that it's really important for all of the work that we do to be reaching those folks. We also know that, like many things in life, when you start young by having some good patterns, you're more likely to perpetuate that later in life as well. And so having health insurance, using the preventative services that are available, is more likely to continue on. So real quickly, I wanted to just dispel a few misconceptions, and then Byron's going to go into a lot more of the kind of overall best practices. I think everything that we went through this morning, everything this afternoon applies to young adults. There's just a few things I want to just kind of stress or highlight. One is, I think that when it comes to health education, health literacy, there's a misconception that young adults they don't care, they don't want to be bothered, they'd rather be on their phone texting, watching Netflix on a movie, hanging out with friends. The organization that I work for, the Arizona Public Interest Research Group, we have done work through our network on college campuses, and myself for over 30 years. I cannot think of an issue that has drawn more attention, that we've had more students and other young adults coming up to us, asking us questions for a second time, a third time, a fourth time, and that have actually brought friends and family members to get information or to learn more. So I think we got to dispel the myth that young adults don't care about this. I think we need to instead look at how we can reach them with the kind of language that we want to reach them with and the opportunities that we want to reach them with to get them involved. Second is, I think there's this notion that because, particularly if you're looking at young adults on a college campus or that are in a professional business setting, that they may be educated, and so they're going to be familiar with these terms. This morning I heard the word complicated, I heard the word confusing, I heard several other words to describe understanding health insurance. Young adults are no different than that, and in fact, I'd argue that a lot of the other research that our organization and others have done have looked at the fact that young adults, when it comes to even getting auto insurance, they're not driving as much as they once were. When many of us, we couldn't wait till we were 16 to stand in line for that driver's license. A lot of them are just ditching the notion of even having an automobile. And so where they may have at one point understood terms related to auto insurance, health insurance is oftentimes the first time that they're learning about things that Matt and Alan and Melissa talked about, what a copay is or what a deductible is. And so it's important to just kind of keep that in mind. And then lastly, I think there's this notion that, again, young adults in particular don't want to be having to pay for anything, and they want to get as cheap of a plan as possible. Just like we heard earlier today, that isn't true. When you explain the kind of full range of costs, we found that young adults oftentimes are really making that calculated description, and the more that you're able to really pinpoint for them what it means. If you are on a prescription each month, or if you have some type of illness that's requiring you to have certain medication, or if you have asthma and you have an inhaler, being able to just practically kind of point out to folks what it involves is something that we found young adults are making that calculation and are willing to pay a little bit more. And then ways to best reach young adults. Anyone here who's interested in kind of working with us, working with the young adult subgroup for Cover Arizona, again, I'm going to ask Tim to raise his hand, myself, just come up to us afterwards. We'd love to plug you in. Again, I don't think this is much different from some of the points that Byron will probably stress, but wanted to just kind of single out a few of the things that we found best in reaching this demographic, whether you're talking, again, education, enrollment, just overall health literacy. Be straightforward, avoid rhetoric. One of the things that we found more often with young adults and other parts of the population is they just want somebody to give it to them straight. They're tired of the politics, they're tired of the noise, they want to know what it means for them. We talk a lot about what are your rights, what are your options, and they want to be in control of the decisions that are being made. They like hearing that somebody isn't going to make a penny off of the plan that they choose, and so the more that we're able to help explain that in enrollment or when we're talking health literacy, help to break it down for them so that they can make their own choices, the more likely they are to be engaged. Second is to reach them where you can grab their attention. And so we have found for our organization that going into classrooms when you can get access on a college campus to do that has been great. It's an active audience, 3 to 4 minutes. You can describe some of the health terms to them. You can talk a little bit more about what it means to be health literate. You can talk to them about how they can get enrolled. Things like concerts, sporting events, I think all of us would probably agree for our own lives, if we've got something that we need to be at a certain moment in time, it's probably not the best idea to stop us there. Same for young adults. The one exception I would say for young adults is if they're just going to an event anyway, we have found that they will stop and talk and put a phone number or get onto the connector right then and there if they want to learn more or find out how they can get additional assistance. And then lastly, we realize not everyone can do this, but to the extent that you can make sure that your services have more peer-to-peer outreach in them. We found that, not only in health insurance, but in kind of life in general, the more that a young adult can be talking to another young adult, whether it's over the phone, through social media, by bringing friends along with them to an event, the better off the rate of success will be overall. And so we encourage you to think about, for your own organization or the work that you do, if there are opportunities like that to engage folks, and even if folks might not have some of the training that you do, but there's somebody that can speak as kind of a witness to the educational opportunities or to the enrollment opportunities, all the better for getting them to be involved. And so, again, I think you'll hear more from Byron on just kind of overall, and those are certainly applicable to young adults, but really encourage you to think of ways that you can engage the young adult demographic and get them to help spread the word to other folks as well. And if you have specific questions or want to get more involved, please see Tim or myself afterwards, and we'd love to work with you on this. Thank you.
Good afternoon. Take just a moment and look around at the individuals of your table. Gaze deeply. Imprint those and memorize. And you know why? Because you're looking at people that make a difference, and that is what a difference maker looks like. The impact that you have is incalculable, and I'll tell you why. How many of you have been single mothers or fathers without insurance, wondering in the morning when you get up if your kid has an accident, what's going to happen, or where you're going to go? You think all you're providing with these people is insurance? You're half wrong. What you are giving these people is so much more when they sit across from you, is you are giving them hope. Now, you've heard a lot today about the Affordable Care Act, what it is and how it works, and what I'm going to show you is how to do it in some ways that have been best practices across the state. What do you see when you look at this picture? Some of you have seen it before. You guys, how many of you would like to take her out? Or maybe you'd want to put her in an old woman's home. What do you see? What you see is how you may or may not define the individual that sits across the desk from you. It is both. It's an old woman and a young. How many of you see the old woman? Okay. How many of you see the young woman? How many of you see both? Okay. profile. This is the young woman. There's her nose, the plume of her hat, her chin coming down, and a necklace. For the old woman, this is her mouth, this is a scarf over her head, and her eye. See it a little bit? Okay. How about this one? Let me help you out. If you can read this, you have a strong mind. This message serves to prove how our minds can do amazing things, impressive things. In the beginning, it was hard, but now, you picking it up? This line right here is Affordable Care Act Year 3. The first part of that is Affordable Care Act Years 2 and 1. And what happens here is as you become more familiar with it, you get better with it. Now, believe it or not, I have 11 grandchildren. And I have one little ball of dynamite whose name is Chloe, and she lives in Gilbert. And we're walking down the street, and we come across a bunch of parking meters, and there's a quarter on the ground. So she picks up that quarter, and she walks up to a parking meter and puts it in and turns the knob. And I'm thinking, great, this little ball of dynamite is 8 years old, and she's already learned how to serve other people. I start walking away, and I feel this tug on the bottom of my shirt. And I turn around, I look down at her, and she flashes those big blues up at me, and she says, "Papa?" Yes, Chloe. She goes, "Where's my gumball?" There's a lot of people that are going to come into your office when they go through the Affordable Care Act that are looking for a gumball. And you need to be able to explain the difference in them. How you respond initially may make all the difference. Here, perhaps, is the most important best practice that I've run across, and believe me, the many travels that I've done, you'll hear about that in a moment. This is not a political issue. This is a health care issue. So how do you explain that to people who come in? I live in perhaps the most conservative town in Arizona, in Snowflake, Arizona. You know what? Over 5% of the people in that town are now on the marketplace plans. I would wonder if there's any other city in America with that same ratio. Why? Because we did not make it a political issue. So how would you respond to somebody when they came in and they told you, "I hate Obamacare," or "I can't stand this or that," or whatever? Can I suggest a good way to do this? I sit the folks down and I say, you know what? In 2010, the House of Representatives passed what became the Affordable Care Act. The Senate ratified it, was sent to President Obama, who signed it on his desk, and it was enacted into law, whereupon it was immediately challenged by the Supreme Court, which upheld it to be the law of the land. Fast forward 5 years later, it was challenged again in the Supreme Court. It was a narrow victory, but they upheld it to make it the law of the land. My question to you, sitting across the desk, is, would you like to know what your options are under the law? And that is how you diffuse a political situation. If they want to argue with you past that point, you can nod your head and be polite, but you say, what we're here to do is to let you know what your options are under the law. If you don't agree with the Affordable Care Act, then do what President Obama suggested, and that's vote for change. But vote. If you like it, sustain the status quo. But between now and whatever eventuality you hope to obtain, let's examine what your options are. Here's door number one, because if you don't have health insurance, you're going to have a penalty this year, and that penalty does increase. And when I ask them this question, they all agree. They all agree. How about you? Same thing? Okay, then it becomes not a sell, but it is an opportunity to help them improve the outcomes of their lives by helping them have a healthier outcome. Now, I want to give you a little bit of background on the bona fides here. I've worked as a navigator for about 2 years. My territory happens to be the largest one, not only in Arizona, but in the whole United States. I cover 5 counties, including the second largest county in and of itself, Coconino County, in America. During that period of time, I have traveled, as of this morning, almost 63,000 miles on a company car. By the way, if you want to stay alive when you drive that long, get you some dang good audiobooks, because it will keep you going. During that time, I have given over 225 presentations. I've talked over 200,000 people. You know some of the things that I found out? This isn't to impress you, it's to impress upon you the impact that you can have as a single individual. The thing I found out is most everyone I've talked to wants health insurance. Almost every single one of them. Second thing is, most people, over 90% of them on a national average, don't know when open enrollment begins or ends. Quick, when does it end? January 31st, we hope. Historically, it's been extended sometimes up to 3 months, right? But that's when it ends, and you know when it begins. You're ahead of the game. Most people don't. Most people don't know that there's a penalty. And I'll talk to you in a minute on a good practice on how to explain the penalty so the sting is taken out of it. Also, most people are hardworking. They are not looking for an easy way out. They are working in several different industries. Some of them, I knew a guy who was working for McDonald's. He was making $10.25 an hour as a supervisor, and his wife had one child, one on the way with complications. He was doing everything he could, but he couldn't afford health insurance until this came along. Most people need help navigating through the system. How many of you have ever done an access application? It's not for the timid or the uninitiated or the young, is it? It's nice to have some help going through that, somebody that's been there that can build trust and kind of show them the ropes. The other thing I learned is that most people are closer to being insured than ever before. They just don't know it. And that's something that you can help them with. Overall, the experience for me helping these people has been overwhelmingly positive. And it can be for you. So how do you go about doing some of these things? Well, every person you talk to is like the stone thrown into the river or the lake. It's a ripple effect. They'll go tell somebody else and so on. Here's what we found works for us. Faith-based organizations. A lot of them. I specifically have had great success with LDS Social Services and Catholic Charities because those are the predominant organizations in the footprint areas where I serve. These people that you go and talk to are people who know people that are uninsured. Remember the Statue of Liberty, give me your tired, your poor, your huddled masses? Well, how about give me your tired, your poor, your uninsured? Any people that you can help that are through these faith-based organizations or people in that congregation that are in need, and the pastor, the bishop, the ecclesiastical leader will be grateful for any help that you can give them. I've done a lot of radio presentations. You know what? They're scarier than being in front of you. You know why? Because they're recorded for all time. So you can block the mic now. They're recorded for all time in living color. They end up on YouTube. If you make a mistake, it's for all posterity to enjoy. But you know what? You can do the same thing. And you don't have to get live behind the mic. Do PSAs, public service announcements. Let them know when events that you have are being scheduled. Let them know where your office is, how you will be available. Do you know how many of these guys on these radio stations are dying for people to come in and fill the required public service announcement slots that they have to fulfill by law? You're doing them a favor. Do what you can to help them out. Networking. Okay, I want to take this in two different levels. I'm sitting there during the first year of the Affordable Care Act, and I had a question, so I called the 800 number. The 800 number could not help me. Any of you ever have that experience? They said, we're going to put you on hold because we know somebody in Arizona in your area that can help you out. And I said, okay, great. So I'm sitting there, and about 10 seconds later, my phone rang. It was the Affordable Care Act people calling me to answer my own question. Can't make this stuff up. So what I learned to do then is I connect and make relationships with people like Lourdes and Marco and Merrill and Alan and Kim and people all across Arizona and in other states that have similar interests, similar challenges, and that are working in the same type of environment. Network and take advantage of the situation you have here today to make a relationship, because I guarantee you, Picking up the phone and calling them is a lot faster response than any other way you can go. Okay? Working with local network areas is important too. How many of you belong to different boards or different organizations that meet on a monthly basis? They all have time. Personally, I do some volunteer work for First Things First, and I went out and made sure I could be involved in our community. Use your voice. Get in front of those different groups. They love to have people that will come in and give a 15-minute presentation. If you need some help, let me know, and I'll be glad to have Kim Van Pelt show up and help you out. I spent 1/3 of my time last year as a navigator answering this one question for people. I need health coverage. What do I do now? You know who your best referrals are? It's the people that you've already helped. Make doubly sure you answer that question for them. They need a soft landing. And once they get insurance, best practice, the thing that I have learned that is the most discouraging is as they call and it takes them 3 weeks to get in before they can see somebody. Do your homework. How many of you read the Affordable Care Act? Okay. Yeah. Is it a cure for insomnia? It will put you to sleep faster than, watching any public debate on TV. It will knock you flat out. But you know what? It's important to read that so that you'll find out what's not in there as well. Make sure you do your homework. And then the final thing, are you eligible? I have here a sheet that we'll make available to you. It's a cheat sheet. I like cheat sheets. It's a great cheat sheet. How many of you know, for example, when somebody comes in to apply for Access or Medicaid, that if they've been in the military, they need their enlist date, their discharge date, and their military number? Yeah, it's because you've done it before. All the information that they will need for this and for SNAP is on this single sheet. You send it to them in advance, and guess what? Your enrollment time goes way down. Now, best practice on enrollment here, you will spend more time helping somebody get their account created than you may spend getting them enrolled in a project. Is that not true? Okay, so how do you go about getting around that big hurdle? Be familiar with Yahoo, Gmail, Hotmail, and how to create those accounts quickly. Make sure when they come in that they've got a smartphone, because you do not want their email set up on your computer when they leave that room. Who knows what kind of crazy stuff you're going to get. The other thing you're going to do is you're going to tell them where they need to go to get help. Now, here's something else just to know as far as talking points. Would you be impressed if I told you that 96%, how'd you like to get that score on every test you took? That 96% of the people who enrolled in a marketplace plan last year and paid their premiums through the year re-enrolled this year. That is a huge hit rate. Why is that important? Because people like to know that other people are involved in the same process, that they're feeling the same things, they have the same fears, they've had some of the same experiences. The other thing to know is 82% of the people that applied for marketplace health insurance received tax credits. I think in Arizona it was 84%. The average tax rate in Arizona was $154-ish. Every month, applied to their premium or however they choose to take it. An individual earning up to, $45,000 and change could be eligible for tax credits. At the end of the day, they're closer to insurance now than they have ever been in most instances before in their lives. All right. You are going to get in more trouble if you disobey this principle than just about anything else. Do not cross the line. There is a big difference between opinion and facts. There's a big difference. Opinion is an attitude or a judgment. Like, well, I think this is a fact that the Green Bay Packers are God's favorite team. They wear his initial on their helmet, right? They play on his day. No? Okay, we'll take that as an opinion. There must be a few Dallas Cowboy fans here. Here's what they're going to ask you. What plans are best for me? Here's the killer. Which one would you choose? And it's an HMO better than a PPO. Don't get sucked into that trap. Present facts. You're going to tell what actually happened. Like 96% of the people that picked the plan last year and stuck with it re-enrolled this year. That 84% of the people have the chance to get tax credits or got them. Let's see where you end up here. Let's look behind door number 1, door number 2, door number 3, and examine your options under the law. Because if you don't have health insurance at the end of the year, you're going to be paying a penalty. Now, do not make any prejudgments. When I was a little guy, about 13 years old, we owned several trading posts. I'm a 6th-generation Arizonan. My grandma, who just died a year ago at 103, was born before Arizona became a state. So I grew up out pretty much on the Navajo res. And we're out there one day, and this lady and her boyfriend pull in on a Harley motorcycle, and they come into the store, and the guy was kind of rough, and the girl was wearing a leather miniskirt and a leather bikini top. And she did not have a purse, and she did not have a wallet. So I didn't think she was going to buy anything. And my dad walked over and started waiting on her, and I thought, man, wait till Mom sees this. She's going to hit the roof. Well, he ended up waiting on her, and she decided to buy a bracelet for $300, and my dad said, will that be cash or check? And she goes, cash, and reached in and pulled out $300. I mean, I couldn't believe it. But I walked out from that experience learning that I never made that mistake again about whether or not a customer could or could not pay for something. That's the same mistake that you want to avoid making when somebody's sitting across the desk from you. Let me tell you something else. This is important. They know their needs better than you do. And if you listen long enough, they will tell you what their needs are. Your responsibility is to present options, not make choices for them. I have a client that came in that had just had a kidney transplant, and she needed health insurance. She was on COBRA, it was going to expire. We got her all lined up, and it came down to picking between 2 policies. And we'll call her Nikki. I said, Nikki, this one here is, you travel a lot, this one's a PPO, it's got these advantages, and you know, you're focusing in on this HMO, is that the best decision for you? And she says to me, Byron, I'm going to go with that HMO. I said, why? And she said, because the doctor who saved my life belongs to the organization, and that's how I have to go if I'm going to continue seeing him. You learn that by listening to these people. Now, facts, they tell you what happened. They tell you you're going to ask what insurances are accepted. You know what the 2 big questions that they have when they sit down at this stage of the game? They want to know if the doctor that they're wanting to see is in their network or will be covered by the insurance. And they also want to know if the prescription drugs that they're taking or that they're expecting to take or that their kids take are going to be covered by the policies. Answer the difficult questions. All right? Don't dodge them. Answer the difficult questions like this. I hear this all the time. Byron, you've seen hundreds of plans in the marketplace. Which one do you think is best for me and my family? How would you answer that? What's that? You are not the decision maker here. You are absolutely correct. But how would you do that? How about something like, you know what? Nobody knows your business better than you do. Here's door number 1, door number 2, door number 3. Let's examine the options. Or you have a daughter that's the same age. What one should she take? Same principle. Do not get caught up in that trap. If you cross the line seriously, then you are responsible, even indirectly, for the medical decisions that they make. This is their choice. This is their time. You are a facilitator. You present them evidence. You give them options, and then you let them make the choice. What's just better, an HMO or a PPO? Well, you know what? That all depends. An HMO does this, and a PPO does this. And then you let them make the decision. Now, this one will get you in just about as much trouble. PPI. This isn't a Magnum PI thing. This is people's private, personal information. Stuff that is sacred, sacrosanct. See? Somebody gave up PPI and they're coming for them. Everything that's on that list is considered PPI. Every single thing. How can your personal information be stolen? How many of you have ever heard of somebody saying, well, you know what, if you just give me your information, I'll scan it into the computer and we've got it? Or you set up their email account and you don't delete it after they go. Here's a good practice to remember. When somebody comes in, if you have dual screens, you flip one around so they see everything that's going on that desktop. If they have personal information, you give them a folder. I have a huge purple folder, partly because purple's the color of royalty and I want them to feel special. No, it's just purple was the one I could actually see the most, and I wouldn't do pink. I give them this purple folder and they put their information in that, and then we pull it out as needed. They hold the information. I'll look at it after I've had their authorization and either enter it in for the keyboard to the application, or they will do that themselves. But that personal information never leaves their hand. Somebody comes in and walks off with their identity. How many of you guys have ever had your identity stolen? Yeah, I had ours stolen the other day. We found out somebody had run up a $5,000 bill on a Discover card. But I wouldn't mind them stealing my identity, I guess, if they were going to pay all my Social Security benefits, but it doesn't work that way. But you know what? If that ever gets traced back to you, that is a huge problem. In fact, as you'll go through additional training, you'll find out through the Alliance that, they'll do audits. They don't audit much more than that, but they will check to make sure that you're protecting that information. Also, make sure that you get a consent form. Now, there's a couple of things on a consent form that you may or may not want to add to it. One of them being that they will allow you to use their contact information to contact them for next year's open enrollment cycle. If you don't have that, it's going to be tough to make that connection. All right. What are you responsible for in terms of personal information that somebody comes in and gives you? Everything. Now, I may not be faster than a speeding bullet, but I tell you this, I'm faster than a 2006 Kia in a parking lot. Because somebody, if they leave their information on your desktop, you better catch them out there before they hit the road. All right. Any questions on any of this? All right. Now, I've had some talks with a lot of people about penalties. Personally, I'm not a big fan of penalties. I don't like them. But I know that if I am going, I used to believe that, when you saw a speed limit sign and it said 65 miles per hour, that was the minimum. That's not true. But I know if I get caught speeding, I'm going to be paying a fine. The same thing is true with the Affordable Care Act this year. So can I share with you a practice that I have found that works very well in helping people understand their obligations and their options here under the law? They come in and they said, I hate this Affordable Care Act, I said, you know what? I wish there were some things that were different too. I wish that deductibles would be a little bit lower and that the open enrollment would be longer and, a couple of other things. Said, but between now and whatever happens, this is the law. And if you don't have health insurance this year, you are going to be looking at a penalty. Let's take a family of 3, and then I give them this information. Keep in mind that is the minimum penalty. Notice here that each year is an accelerated rate on the penalty. So a family of 3 this year, 2 adults and a child, are looking at a minimum of $1,737.50. Most of the people that you work with and that I work with, that is vacation money. That is school clothes money. That is, if I pay that, I don't make my car payment money. Now, once they've seen this number, I'll say, you know what, let's take a look at what the lowest level bronze plan is. They say, okay. And they're anxious to see that then. We show them what the lowest level bronze plan is. In many instances, even without tax credits, it's lower or within a few $100s of what they'd be paying in the penalty. So my question to them is, well, would you rather pay the penalty and have nothing to show for it, or have some peace of mind by having insurance? Most always they'll say, yeah, I want to go with the insurance. Some of them say, no, I just really can't support this. I'm just really against the Affordable Care Act. I wish it would go away. I say, great, fine. Then go ahead and get the insurance and use it as much as you can. You know, because once they've done that and they start seeing that their kids are getting immunizations and that they get 63 free cancer screens, most of them for women, by the way, and that their children can have their well visits for free, and that their well woman and well man visits are covered, they start to feel the effects, the positive effects of having health insurance, many of them for the first time of their lives. Do not get into an argument with them. If you choose to reduce it down to basics, aside from money, it becomes a moral question. It's either you obey the law or you don't. And if you don't obey the law, okay, but here's the penalty that's associated with the law. Now, how is that penalty collected? Taxes. You know, they don't lose that on servers, okay? That is out there, and they will find that. I have some very good friends that are accountants, and that's another good practice. Make friends with the accountants in your towns. They will refer a lot of their people to you because they look like heroes. They look like heroes because these people come to you and they get insurance and they can avoid paying the penalties. Now, here's why this is significant as you look through those numbers. I was born and raised in Holbrook, Arizona. Any of you ever been through there? You've seen the wigwam, the whole wigwam hotel? My dad and granddad built those. I lived there for the first year of my life. My wife said that explains a lot. Holbrook used to have a hospital. It was a thriving hospital. Border town, right not far from the Navajo, Apache, and Hopi reservations, centrally located. In fact, the busiest tourist intersection in Arizona. There's 1 million people a year that pass by the Navajo and Apache Boulevard there in Holbrook on their way to Grand Canyon or Petrified Forest. That hospital couldn't make it. Why? Because really good people with solid intentions got sick, they got hurt, and they, for whatever reason, couldn't or didn't make payments to the hospital. It went under. And so the city took it over, and they had the same experience. Since 1979, the population of Holbrook has not increased. One of the big selling points to bring teachers to undeprived and underserved communities is how close are you in proximity to a hospital? If they had one there, how big an impact would that make? Providing insurance helps everybody win. Look at these numbers here. Apache Junction, Flagstaff, Nogales, Sedona, Yuma, and Prescott, lump them all into one big group, and that's how many individuals received health insurance or continued their benefits this last year. The one number I'm proud of is the number down at the very bottom. Look at the number of people that rural Arizona enrolled. That was among the tops in the nation last year. Why? Well, last year, what was it, Kim? It was, in Allen, wasn't it like 17,000 or not even that many that were enrolled in rural Arizona? We had an over 60% increase. In Navajo County, there was a 66% increase. Mojave and Coconino were similar. Why? Because people understood the message and were able to give people options. Remember from the initial? People are interested in having health insurance. They just don't know where to go to get it. And they don't know where to go to get answers. Now, I'm a research junkie. When I went to NAU, it was to play basketball and to debate on their national team. And we did well, and part of the reason was we spend all our time in the library. Well, when the Affordable Care Act came out, by the way, the Affordable Care Act is about 375,000 words. So if you ever, if you want to just really kind of get into it and read this thing, it's about the size of Harry Potter and the Half-Blood Prince, or my personal favorite, The Three Musketeers. Try it one night. Well, when I was in the library and on the internet, I started researching healthcare, Affordable Care Act, and I started reading some different headlines. This blew me away. Critics storm that healthcare reform is a cruel hoax and a delusion. 100 newspapers thunder that healthcare reform will mean the beginning of socialized medicine. That was from my personal favorite, the Wall Street Journal. They go on to say how it will be encroached into the bedroom, the medical room, the school room, how it's going to be bad for business. This will blow you away. Every one of those quotes come from newspapers from 1938 or 1960. And you know what they're talking about? They're talking about Medicare and Social Security. Now, my dad is 81 years old. He just had a heart attack a couple of weeks ago. When we were all younger, this is kind of funny, he was a chocoholic. He would eat chocolate chip cookies and ding dongs and deep fried Twinkies but he's never had a cavity. Go figure, right? Well, they're getting a stent put in his heart, and he sees this little blip on the screen. He's awake, he looks up and he asks, "Is that a chocolate chip?" But with him being 81 years old, I asked him, I said, you were just a young guy when Medicare came out. What did you think? He said, "I thought it was socialism. I thought it was going to be the worst thing that ever happened." I said, "What do you think about it now as we're getting ready to, wheel him in to have surgery, put another stent in?" He says, "I don't know where we'd be without it." 5 years from now, Affordable Care Act is going to be in the same place where Medicare is now. It's just going to be part of our every yearly routine where you go through it. It is in your best interest and the best interest of the people that you serve, by the way, who are the underserved. In Arizona, 2 of the top 100 poorest counties in America are in our state. Navajo County, number 85, and Apache County, number 7. Okay? That's where you're at. Now, are there any questions, or would you all like to get out early? All right. Thank you. You guys have been a great audience.